Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Neck crepitus: popping and cracking noises when you move your head. Neck crepitus is clicking, cracking, popping, and grinding sounds in your neck. Popping at the base of your skull can be surprising, even alarming, but it's most often caused by common issues like tightness and stiffness, poor posture, or arthritis. /r/n/r/n Occasional neck crepitus isn't normally something to worry about. But chronic, repetitive, or painful cracking could point to a more serious problem. /r/n/r/n/Verywell, Ellen Lindnerrnrn Crepitus is cracking, popping, and grinding sounds in your joints. You may hear and feel it when you move. These grinding sounds and sensations are often tied to stiff joints that have cartilage damage. /r/n/r/n The cartilage in joints helps your bones glide smoothly over each other. But cartilage can be damaged or worn away, especially as you get older. When this happens, bones grind against each other. /r/n/r/n Cracking and popping sounds are often the result of air bubbles that form in the empty spots within the joints. This is called cavitation. Scientists used to think the crackling sounds came from the bubbles popping, but researchers suggested it may be from the bubbles forming. /r/n/r/n When you suddenly force the joint to move a certain way, different parts of it will briefly come apart, and open up cavities where the bubbles can form. /r/n/r/n Either way, you'll hear a popping sound when you make quick movements. These sounds could be the cracking of your knuckles or the bending or twisting of your neck. Once you pop a joint, it won't pop again until the pressure has time to build up, usually after about 20 minutes. /r/n/r/n Cracking, popping, and other neck noises can be caused by many different conditions, but these are some of the most common. /r/n/r/n Excessive neck cracking, popping, or grinding can be a sign of a more serious problem, including instability of your cervical spine. See a healthcare provider if any of these symptoms in addition to neck crepitus: /r/n/r/n Joint cavitations and cracking are more likely in joints that get more resistance in surrounding tissues, such as /r/n/r/n Poor posture can also cause neck stiffness and limit movement, which can lead to neck crepitus. /r/n/r/n Your regular healthcare provider, an orthopedic doctor, a physical therapist, or a chiropractor can usually figure out what's causing you to have neck crepitus. /r/n/r/n In general, neck crepitus can be diagnosed using /r/n/r/n During an exam, a healthcare provider will listen for neck crepitus when you do certain movements. If crepitus is chronic or causing pain, your provider may want to do imaging of your neck, like Xraysor magnetic resonance imaging, MRI. /r/n/r/n Here's what they're looking for on the tests. /r/n/r/n Neck crepitus is usually caused by a stiff neck, and the treatment goal is to restore the range of motion and mobility of your cervical spine. /r/n/r/n If there is a specific underlying cause, like an injury that needs to heal or a chronic condition that needs to be managed, your provider can recommend a treatment targeted to that condition. /r/n/r/n Some common treatment options to help with neck crepitus include /r/n/r/n Neck crepitus can be heard and felt if you have worn away cartilage or gas bubbles inside the small cavities inside your joints. Poor posture, injury, or arthritis can also cause neck crepitus. /r/n/r/n Your symptoms, a physical exam, and imaging of your neck can help a provider figure out why you have crepitus. /r/n/r/n Treatments like heat, stretching and strengthening, and improving posture can usually help with neck crepitus. For specific conditions that are more serious, surgery might be an option. /r/n/r/n rxcardclub.com Get a free prescription drug card and save up to 80% on prescription drugs.